Let's ask for the permission. So, hello everyone. Thank you for being here tonight. I'm Supriya Bhualka. I'm the founder of Coding and More. We are a personalized edtech that teaches AI and coding to children from 8 years to 15 years. We are very passionate that children learn the AI tools and learn how to apply it in the different industries. So, as part of the monthly, the lives that we have. This month, we are focusing on healthcare, and we are very, very excited to have Cheryl Netterfield with us here today from Canada. She is a physician. She is also now an entrepreneur and the founder and CEO of POMMe Health. She has worked in the national defense, and that's where her passion comes from. And I take over about her work, why she's choosing to do what she is, she to take technology in a field like oh, am I freezing, and how she chose to use technology in healthcare. Sorry, I'm going to put my video off. I believe my internet is lagging a lot. Cheryl, over to you.
Okay. Hello. Good morning from Canada and good evening over there for all of you. I'll just build upon what Supriya mentioned. I'm a family physician by training and worked for 25 years with the military in Canada. And during that time period, there were complex patients that we were taking care of, and they were managed by a lot of different healthcare providers. So you could manage a patient having a doctor, a nurse, a physiotherapy, a pharmacist, maybe a specialist or a surgeon. And we were all trying to manage this complex patient. And sometimes our communication was not very good between us. And we could not always tell how well the patient was doing, how well they were functioning. And this led to a passion of mine to think of starting to develop an application for healthcare to make it easier for the healthcare providers to share this information. And it's changed quite a bit over the years to where we are at right now, developing a software that will be using AI to even better help make decisions for the healthcare delivery for the patient. And there's lots of different ways that this can work. By getting the information from the different providers, the providers will be able to make better decisions because of the analysis of the data. What also can happen over time is that you can find out if you're actually giving the right type of care to the patient. As things change over time and the patient changes their functioning, we can figure out, is this the right treatment for this patient at this time, or do we need to change it? Or do we just need to continue it? Or do we need to increase it? And this is important for many people to understand. It's important for the healthcare providers to understand this, but it's also important for larger organizations like hospitals and clinics to understand so that they know where to put resources. So I think that's a good overview of the type of information that we're trying to look at, Supriya, in the platform that we're developing.
So I guess that you chose to go, to use technology in your field because just with the sheer amount of parameters that you were wanting to track, you wanted that nothing is left to human error, right? Because if you tracked it with your own instinct, you would not be able to actually know all the trigger points of what changed and what could have caused the well-being to go down. Children, at any point, it's a very informal interaction. If you don't understand something, please jump in and ask. If you don't understand something, we're very happy to answer your questions. So everybody is following up to now, what Cheryl has spoken about, how it's different.
I've got one thumbs up so far. Thank you, Hira. It's about looking at the amount of data, but clinicians are very busy. They also need the ability to enter relevant data and have it reviewed and analyzed and put it in a form that's quick and efficient for them. It can't take a lot of time. One of the main components that I was looking at initially when I started to develop this was to make it easy to gather the information. And because we're gathering information from a lot of different types of healthcare providers, including the patient and the family, it needed to be fast and very simple. And then what happens is over time, as you're gathering more and more data, we're looking for the changes in the patterns. So the predictability of the information that we're gathering is going to be where the AI will really aid us and help us in making those decisions, because we don't necessarily see the patterns very well. And this is going to be the important part, is picking up the differences.
So may I ask you a question? When you actually started building this model, where did you get your data from? What was the starting point?
The data is gathered from seeing patients. Like for myself, I do see patients right now, and I go through a checklist with them each time I see them. So I might see them once a week, once a month, and I have a checklist that is customizable for the patient or the type of patients. It takes me on average about 5 minutes to get this information from the patient myself. And I'm entering this, and it's all, we call them discrete elements. They're all numbers. So there's no interpretation from a word or a descriptor because it is discrete. So it makes it a lot easier. We're collecting data that can be used immediately. We don't have to translate it into another form so that it can be compared and analyzed.
Cheryl, would you like to explain this, the way you'd explained it to me last, I think 2 weeks ago, when you said that, these are the kind of questions you ask the patient, and you mentioned that you ask the same questions to the caregiver, to the hospital, and then you sort of compare all of it. No, can you give an example to the kids?
Sure. There's different kinds of reasons that we would track the functioning of somebody. So I'll give you two very opposite types of examples. If somebody had a stroke, we would want to follow how well they are walking and putting their clothes on, and how well they're able to prepare their meal so they can eat. So we look at those three variables. And if they had 5 different healthcare providers, we would ask every one of those healthcare providers what they thought about this from their own perception. And then as you collect this data and compare it, now you have the ability to track the information over time. A different example would be somebody who had depression. And for somebody who had depression, now we're interested in whether they are getting to work on time, how well they are sleeping, and are they having good social connections with other people. And you look at a different set of variables and you ask those different healthcare providers what they think about this from their perception on how well this patient is doing, and then you can compare those. So each functional checklist is specific for the type of person or the type of illness or illnesses that they have.
And Cheryl, I wanted to also ask you, did you find that the data and the prediction changes with depending upon which race, which gender, which age? That also helps. The reason I'm asking these questions is because the children are learning about data biases. I'd also like to touch upon privacy issues so that, they have an all-encompassing sort of picture of what they're learning and how is actually being applied in real life.
Yes, that's a great question. We don't have enough information for that yet, but the information that I'm collecting on the patients that I'm seeing, I include their age, how they identify their gender, how they identify their cultural or racial background. So I ask them that. I ask them about their postal code because I want to know their geographic location, because it can change from geographic location. I ask about their educational level. I ask about their social supports, if they're living with other people or if they're isolated. I ask if they're working. Some people are not working, some people are looking for work, some people are retired. So there are quite a few factors and variables that I ask about for each patient that I see so that we can start to compare that data. We do not, we're at the beginning of this and have not yet collected enough to compare all of this. The database for the ability to compare the information is still being built right now. So we have more work to do. Oh, Supriya, you're on mute there.
Yeah, I actually lost electricity. I'm on hotspot. So you
And
see the
it's dark in there.
Yes, I'm so sorry. But I'm going to have Ishita jump in and ask you the next question because it's odd to talk to a ghost.
Okay.
But I
Oh,
want to
man.
just ask you one question before Ishita jumps in. Why
Okay.
geographical location? Why does that matter?
You could have regional differences may have an impact on the type of resources that are available to somebody. So resources may be more scarce in rural areas versus urban areas. They may have a harder time getting access to different specialists. So there's lots of different ways to look at that. So the geographic regions could make a huge difference.
Okay, now I'm going to have Ishita jump in because it's not nice for me to talk to a blank screen.
Okay.
Sure. I just wanted to ask why you chose to use AI for this. So, and how did AI help you in your endeavor to collect all of this data?
So what was the first part of the question, Ashita?
AI, why you chose to use AI and not just any other technology available?
I must admit, when I first started doing this, I didn't know anything about AI. So what happens as a non-tech person going into a technological field, you need to learn a lot. What I did is started working with the university here with the Faculty of Engineering and work with students so they could start doing some of the back-end coding. And I went to conferences in the area so that I could meet people and learn more. And obviously by being at the conferences, I learned a lot more about AI and slowly built up my knowledge level, did some reading. And then I got introduced to my co-founder, who is a subject matter expert in AI for health technology. So having this person on board makes a huge difference with regards to the applications and how the algorithms will be formed. I have no idea how the algorithms will be developed. I am so glad to have his expertise on board. So we're matching his engineering and AI capabilities with my clinical experience as a physician. And that's really how these innovations come to be, is by gathering people who have different areas of expertise together.
Okay, I think we have a question from Vedant.
Yeah, so can you track people by like a watch or something, or like maybe a tracker in their soul? And like, is it possible to track how they're doing using one?
That's a great question. Where we are at right now does not involve any wearables. So we're not tracking their heart rate or their temperature or their pulse rate or their blood pressure. We're not tracking that kind of data. The kind of data that we're collecting has to do more with how they are functioning and how they perceive their functioning. So there's a difference between how people think they're doing and then how we're observing how they're doing. And this is actually really important. So it is actually more subjective compared to a data point that is very objective and has, and as long as it's a reliable piece of information collected, it's reliable data. So for example, if there's somebody walking with crutches, they may feel that they're walking quite well and they're getting around okay, but I might observe them and say they're having a really hard time because they're still limping. And we're going to have two different numbers. So this is actually really important. We need to compare the numbers. You could have an elderly person who is becoming cognitively, very forgetful, and maybe they forget to take their medications, but they don't realize that they're forgetting. And they may think that their memory is fantastic. Whereas the personal care worker and their family member and the pharmacist, they all say, no, her memory is not very good and she's forgetting her medications. These are the type of things that we're measuring, and we can't measure those from a wearable device necessarily. We have to gather that information and ask people about it and ask them to fill out a checklist to get this information. There's only so much we can do with the type of data that is related to vital signs and lab results. It's as a very small piece of the puzzle when it comes to healthcare. There's a lot more information that we need to collect.
Ira, I think you have a question.
Yeah, I have a question. So you said that the people need to fill out a checklist so that you know all of the information that you need. But what if somebody has memory loss, like you suggested? So how would they fill in the checklist? What if they forgot some of those details? So how would
Yeah,
you
very
go
good
on?
question. Yes, that's a very good question. The checklist can be filled out by the patient, but if they're not able to fill it out, then they could have a family member fill it out on their behalf. So sometimes we can't get the information directly from the patient. And what's interesting is if we think that their memory is still good, we actually may be able to find out from this information that their memory is getting worse. And maybe we'll find this out sooner versus later,
Oh,
because sometimes that information is hidden. And it's quite tricky when we're dealing with people who are starting to lose their memory, because it can be hidden for a while and we don't know that it's happening. As we collect this data, we might find clues earlier that their cognition is changing over time. So that's an excellent question.
Hi.
Hello.
Hi. So I had another question. I think you mentioned that people are, of course, sharing their data, right, online, especially when you're tracking their vitals. So how exactly do you ensure data privacy? Because that is such, it is something that we need to be so mindful of today. So how does that actually happen behind the scenes?
Yes, I totally agree. My engineer co-founder would be much better at answering this question than I would be. But his area of expertise is in data privacy on iCloud, on cloud platforms. So this is his area of interest. Now, having said that, I think what he'd used is it's data rested at, like data, it's encrypted at rest. So there is no sharing of the data other than when it's used. The identification will be unique for each person. It will be site specific. And at this moment in time, we are not gathering any names. Everything is coded right now. We're at the minimum viable product stage and just bringing it on for validation and proof of concept trials and in different clinical settings. And all of the patients' names are coded and protected right now. So there's no sharing of information that would lead to revealing an identity. Excellent question. Data privacy is of the utmost concern, and that is our prime, one of the prime priorities that we have right now. Great question, Tammy.
Cheryl, can I ask, since I have electricity back, can I ask you another question that just popped into my head? When we look at regular medical, right, science, when you, as a doctor, you usually treat symptoms. Here you said that you are treating well-being, right, the functioning. How do the two correlate? In the sense,
yeah, that's very interesting. There's an art form to medicine that gets away from the numbers. So you can't treat a person's lab result and you don't treat their x-ray. You have to treat the person. And there's signs and symptoms. So the symptoms is what somebody comes into the office with. I feel sick, my stomach is bothering me, I have pain, I have a headache. Those are their symptoms. Then there are signs, which is what we look at, we observe. The sign would be a limp, a rash, a deformation, a malformation of something. Those are signs. But all of those do not tell us how well the person is functioning. So somebody with really high anxiety could still be going into work, taking care of themselves, and have a functioning household, where somebody with anxiety that's lower may be having a hard time going into work. So the two don't relate to each other. Just because somebody has decreased symptoms doesn't mean they're functioning well. And we're after improved functioning. Not necessarily, we want a decrease in the symptoms, but improved functioning is more important. So we want people to be able to live independently and take care of themselves. And that is the end goal.
Yes, Ira.
I'm sorry, but I still have another question about the checklist. So if somebody else fills it out for them and you said, how well are you able to manage yourself? And the person who's filling it out for the patient says, I'm filling it out I'm doing it very well. I'm managing to do my work. But when you take a look at the checklist and then look at the patient and you feel that the information is wrong, then what do you do? Like you feel that the patient is not actually doing well.
I
Then-
love the question. This is a perfect question. If a patient had 10 different healthcare providers, I actually don't expect them to give the scores all the same. I expect there to be some differences. That is the wonderful part about the platform, because if there are differences between the scores, there's no right or wrong. It's based on a perception of the individual. And what that does is that it alerts us to talk about it. Because if there are different perceptions, we have to figure out why. If we all agree that the person is having a memory problem, we all agree on it, we can move on. And what's interesting is we spend a lot of time talking about the things that we actually agree on. So we actually don't need to spend the time talking about things that we agree on. When there are things that are different on the checklist, it alerts us, and then we actually can talk about it and figure out why there are differences. And that is part of the beauty of the platform, that the differences is actually where the wealth of information is. And this is where we actually have to talk to each other. We're not relying on the data. We're actually now have to talk together in a collaborative fashion to try and figure out what is the best way to proceed with this patient. So there actually is no right or wrong. There might be differences of opinions, but it's important to pick up those differences and talk about them. Great question.
But what if there are only two opinions, one of the fillers and one of yours? Then
If there's only two people
who do you
filling it
get
out,
to decide? Like the person, there's only one healthcare provider. Like there's only one person who fills out the form and you both have different, so there are only two people who have differences, then who do you get to decide which one is right? Who decides that?
well, that's a good question. This program is most applicable for when there are a lot of different healthcare providers, because it gets really confusing. So as soon as you have 3, 5, or 10 healthcare providers, things get very confusing and quite chaotic. If the person only has one healthcare provider, I'm going to make the assumption that they're most likely fairly healthy. And what happens is the data may not need to be collected for this because the case is quite simple. And if there's a difference in the perceptions, then those two people, the patient and the healthcare provider, can have a discussion about it. But we may not need to put it on the checklist to find that out. So this program works a lot better when there's more healthcare providers, because that's when it starts to get really confusing. And that's why I built this, actually, was to help out cases where there was many healthcare providers that weren't talking to each other very well. Another great question.
Yeah. So, with respect to the diseases, actually, primarily, are you looking at any specific diseases to treat, or is that?
The platform will be open to all of them. And what I've started to do is develop checklists for specific diseases that I'm most familiar with. Now, as a family physician, I have a good broad knowledge base. When I was working with the military, a lot of my work was based on rehabilitation of injured soldiers. So the checklists are starting to be developed. My goal is to have a huge library of checklists, which is also where AI will come in. So a healthcare team can say, my patient has these 3 illnesses. Please tell me the best checklist that meets, the functional checklist for these 3 diseases, and then they can custom tailor it for the patient. So this library will slowly be built up over time. I've built ones for depression, anxiety, ADHD, ones for rehabilitation, stroke. I have a checklist for safe driving. So it's the opposite. Not is the person ill, but can the person drive safely? Can they function well enough to drive safely? So if you think about that, you need to have a certain amount of cognition to drive. So if we have a numerical standard for that, that means they have to meet that to safely drive. It gives the person a goal, or it lets them know that they're not safe to drive anymore. And these are important things to do to make it transparent and fair for the patient. So great question, Tanvi. Thank you.
Thank you.
I had a question. How do the healthcare providers talk to each other? Is there, and is the information that they collect available to everyone? So does everyone have access to the same information, or is it just like you and your company that would have access?
No, that's a great question. Well, everybody's familiar with electronic medical records. And electronic medical records are huge, and they're usually developed by huge companies, and they're used by hospitals or large clinics. Now, an electronic medical record is just a collation of data. It really doesn't analyze it. So what I believe will happen is you'll start to see, and this is like this already, a number of independent applications that will be used to facilitate decision-making with some of the information that's been collected through the electronic medical records. Now, the type of information that we're collecting on POMMe Health's platform is not already being collected. So at this moment in time, we will have a separate application. At some point in time, we hope to integrate with an electronic medical record through a partnership that is in the future. And what we hope will happen is we'll take and use some of the information they've already collected so that it's not duplicated, but then they can open up our platform within theirs and enter the data that's specific for POMMe Health and that, because currently this type of information is not collected on a routine basis. At one of the large hospitals in Ottawa, they're using an electronic medical record called Epic, and it's quite large in North America. And Epic has a separate app store, just like you would see the Apple Store, where they have a number of separate applications, all different for all different kinds of healthcare decision-making tools, but they're not all integrated into the electronic medical record. And I think we're going to see this quite a bit, where they'll be separate, and there may be some joining of the platforms so that we can get certain pieces of information, but I can't see every application fully integrated in all the electronic medical records out there. These applications are specific. They're meant to help people decide about concussions and pharmacy side effects and the things that we're doing. And we're all trying to make these applications specific and very valuable. And the electronic medical record, I don't think could support all of that. I just don't think it'll happen. I could be wrong though.
I have a question. So once the patient gets cured, or the patient gets discharged from the hospital or anything, then do you delete the checklist, or do you throw it away, or do you put it back in the AI so that the AI can learn from that checklist?
No, that's a great question. The checklist will change over time. So the checklist is a live document, and as the patient changes, the checklist can change.
No,
Over
I mean
time.
like the answers, the answers that has been filled in the checklist. Do you save it, or do you put it into the AI for the AI to learn from it?
It will definitely be saved, and yes, the AI will learn from it. And what we are developing right now are a series of dashboards to visually display the information over time so that the healthcare providers and the patient and their family can see how this information is changing over time. And we recognize that the checklist might be a little bit different last year, and then it'll be different today, and it might change in the future, but it will still have the ability to display all this information so that we can learn from it and track it over time to still give us information from the past, but also going into the future. I hope that answered the question.
Yeah.
Thank you.
So Ira, I think also what might help is, I think you started this about 3 years back, right? Your company was started 3 years back?
Oh, yes. I would say that we started doing some background development in 2018. 2019 was quite a busy year. We had a very simple prototype early 2020 and was actually going to start working in some hospitals, but all the research in the hospitals was put on hold because of the pandemic. So, we've been a little bit slower, a lot slower for the last year and a half because of that.
But in the pandemic itself, that must have actually, got you a very different kind of data, right? Because suddenly the patients you were tracking, because they were all at home, you could see that there was a change, like a catastrophe, which has.
I see. Yeah, I don't have a lot of data pre-pandemic. I started gathering the data that I was collecting with my patients, I would say probably October, November, about a year ago. So after the pandemic had already started, I did not have the capability to start analyzing it back then. I'm not a programmer. Everything that I do is very manual, which is why I really love the fact that the platform is here to make this a lot easier for me. It's very time consuming to do this without the platform, very time consuming.
Yeah. And the other thing I wanted to ask you was that, do you believe that there are other people in the world who are, approaching medical health in this fashion? And if so, I mean, would you keep your platform open source where other people can also build with it? Or is it something which is more like a closed environment?
At this moment, it's a closed environment because we still have to do a lot of testing and development. It would be wonderful to partner with people. Many organizations have approached me already. We're just too early to do that still. Yeah, we still have a lot of work to do. So the future is going to be very exciting. I'll be interested to see where we are in a year or 2 years from now.
And another follow-up question I had was that, when you build something, you have a belief and it works, but how do you get other doctors to buy into your idea? Like, you're expecting the other healthcare providers to also fill out the survey, to talk to each other, but first they have to believe there's a science to it, right?
Yes, that's very interesting. Because I'm a healthcare provider and I've worked with all of these people, we all know the weak links that we have right now. And what this is the platform is helping with blind spots that we have that we currently cannot solve very well. So I think when you address a real problem and it's something that is meaningful and valuable to them, it makes sense. At this moment in time, when I was describing it to people and it was more theoretical, I found that the people that were most interested in it were people that were more academic, interested in research, interested in complex healthcare problems. And as I've been working through it and coming up with better visualizations for it and how the platform works, it's reaching a larger audience. But I do recognize that it will be the responsibility of the healthcare organizations and clinics to use this so that their providers can take advantage of it and also that the patients can get the benefits from this.
Actually, you have said the most important thing that I wanted the children to hear. Kids, when we talk about AI being important, data science being important, it doesn't mean that you have to put it in everything to just make it sound cool. What Cheryl just said was so important, that her domain expertise is, medicine and taking care of patients. And she realized what the pain areas were. And that's where she decided to use technology and to get that help to fill in those blind gaps. She didn't do this just so that she wanted to be cool and, say that I have an ML product. No, she actually found a real pain.
Oh, she's frozen up again. But
Priyanka, do you want to turn it
So
down?
yes, I just did that. So I guess the message I want to leave the children with is that if you know a real pain, then you solve for it.
yeah, I definitely agree.
And I think
Priyanka, you got cut off.
We could build upon those thoughts, Ashita.
Yes. So I think what she was saying was that a big thing we teach our children, especially through like the Girls in AI hackathon and stuff, is identifying a problem and then working towards a solution for it. So identifying a real area that needs a solution and then working towards that. And I think that's exactly what you've done, right? Where you've found a pain area for not just you, but for many doctors in your profession, and then built an AI application that could help all of you. And I think that's what Supriyanti was talking about, and how that's very important, that identifying the problem and then working towards a solution is, and not just, developing something and hoping that it could have use.
Well, you could spend a lot of time working on something, and it depends how important your time is to you. We want to make this time worthwhile and a good investment of our time. I'm doing this with my own time because I believe it's going to work, and I have a lot of support from other people that this information is very important. Sometimes you are taking a solution that you've built based on a problem that you've identified, and you're introducing it to people even though they may not understand the solution is going to work yet. Not everybody is familiar with data collection or AI and the decisions that can be made through algorithms taking the data. So there's a big component of education in this also, and helping people understand the benefits that they can gain from this experience. It's also fun to solve a problem. It's much more fun to take something from real life and solve it, and it is so rewarding. It is so fulfilling to be able to do that. I think that's what inspires me every day. That's what keeps me going every day.
Yes, I think that's absolutely true. And I think all our children who've also worked on their projects in the hackathon will say that, right? Where they've identified real world problems and tried to build solutions for that. I just had one last question for you, which was a big part of, collecting information, whether it's in the medical profession or even in mental health professions, is like consent of the patient. So are the patients given informed consent? Are they allowed to withdraw from giving their information at any point if they don't feel comfortable sharing their information? How does the consent aspect of this work ethically?
Okay, so when a patient receives care or goes to get care from a care provider, there's already implied consent that they will be taking care. The gathering of the information that we do is part of their care plan, is part of their care program. There are viewing privileges based within the platform on what is needed to be known by the individuals. Now, the information that we're collecting is based on functional outcomes, and the data will signify if they're doing something well. So part of the circle of care, everybody on that team from a clinical perspective will have the ability to see that. And then as we collate together, as we group together, we're coming up with a care management plan where everybody has a responsibility. So if you don't know what the other people are doing, how do you know where you fit in? If you know that somebody's having pain, 3 care providers might be responsible for that. That might be the physician and the physiotherapist, and maybe, the psychologist. And then if you look at the next aspect, maybe they have something else going on, and there's going to be 2 other healthcare providers, but each of you need to know what the other ones are doing. And when we talk about healthcare providers talking to each other, this is the part that we don't know about. We always assume that somebody else is taking care of that issue. So on a platform like this, part of the platform is to create a care management plan that's on one page that tells you what all the issues are and what every single care provider is doing. So that on one page, we have an accountability structure. It's very transparent. And this will be made to the entire team, but also the patient and the family, because then everybody will know what's going on. And this is for the betterment of the patient's care. It's not sharing, I was going to say, intimate details about their healthcare. It's sharing details about this person is having troubles walking. Who's going to help manage that? And so there can always be consent built in where the information can be selectively shared with some and not others. People will be able to enter information into the platform, but maybe they cannot see the care plan. So if they're not clinical, they may not have access to the care plan. So it's ongoing maintenance of these viewing privileges, I guess is what we'll call them, that will select out who can see what information or not. It's quite complicated. It's very complex.
Yeah, I'm sure. Okay, great. Thank you. Children, do you all have any questions? No? You
Not
got-
anymore.
Okay. Supriyanti, do you have anything to add?
I just want to say thank you so much. This has been wonderful. I learned something more today from our previous conversation. I'm so sorry that I've had to keep my video off. So just to be, properly in the right etiquette, I'm going to have Ishita give you the vote of thanks. But I think you've really touched upon really, really important things that we are teaching the children, and they're seeing it how it's being played out in real life. But
Thank you
Ishita,
so
over to
much.
you.
Yes, absolutely. Thank you so much for joining us today and for educating us a little bit more about how AI can be used in different aspects, especially in healthcare. I think it was very interesting to see how it's not just tracking vitals and things we've been used to seeing around, but it's tracking functionality and keeping an overall check of their well-being. So that's really interesting. Thank you so much for joining us.
You're very welcome. I had so much fun and I loved the questions. It's nice to hear things from different perspectives because it helps me to continue to clarify my message and move forward. Thank you very, very much.
Thank you so much. That was very informative. Thank you.
You're very welcome.
Can we all give a heart to Cheryl? I learned this from one of our panelists and I love it. It's very way of giving our love to you for really giving us your time.
Thank you so much. I really enjoyed it.
I wish you all the success, and I hope one day your platform will also encompass children and, most of the things, because I agree with you that it's very important to have the patient's details all on one page. I understand that pain area. So thank you.
Thank you very much. Have a lovely weekend.
Yeah, you too.
You too. Thank you.
Bye-bye.
Bye-bye. Thank you.